Good evening. I wanted today to talk about a patient that I took to supervision back in March this year. And I've had an incredible amount of learning experience since I took this to supervision and kept working with this patient till today. This patient previously had a diagnosis of post-traumatic stress disorder, and I had been working my way through the EMDR protocol for treatment. And I had done the phase 1 assessment and the phase 2 around stabilization. And part of stabilization, I found that my patient often presented in a state where she felt a lot of inner conflict around, did she actually experience bullying at workplace or did she imagine it? So I used an intervention called Fraser's Table, which is an intervention that allows it's an imagery-based intervention where you help the patient relax and go internal, and to be able to create an internal meeting room and to invite parts of self forward. The part that endured the bullying, the part that sort of is more logical and questioning whether it was actually bullying. And in doing that intervention, it actually unlocked the client's awareness that she had quite a few dissociated parts of self. And when I did the Fraser's Table with this patient, and she just reported a number of parts there of different ages, different qualities of personality, it left me feeling really confused, and it left me also feeling some doubt for quite some time until I spoke to my supervisor back in March. And when I spoke to her and I tried to understand my client's symptoms through the structural dissociation model and through ego states therapy in order to work with the parts, my supervisor was actually quite reassuring. She said to me that even though I feel like I unlocked my client's sort of parts, and I felt guilt over it, the reality is that it was already there, and all I did was help the client sort of gain some inner awareness or shed light on the fact there that she is a highly dissociated patient. And when my supervisor went through the dissociative sort of scale, it's called the multidimensional inventory of dissociation. It's a mid-assessment. When I went through the mid-assessment again, my supervisor said, it looks like this patient has already, it's a self-reported questionnaire, and the patient has already noticed that she's highly dissociated, and she had periods there with amnesia and sort of a loss of identity and a loss of sort of clarity in thinking. So my supervisor said to me that it's very appropriate and common for DID patients, DID type diagnoses, to emerge during therapy, because that's where the patient is doing some deep work and trying to gain internal clarity. And once I had sort of worked through the guilt of unlocking this patient's sort of dissociated parts, and then looked at the diagnosis of dissociated identity disorder and talked to my patient around what was actually happening in her system, my patient actually felt extremely glad and at peace that she could finally make sense of why her experiences felt so fragmented and contradictory, and why she could sort of never hold on to one decision for more than a few hours. And then what ended up happening was my patient was actually able to map her system for, with help, but mostly she did it independently. She was able to find silhouettes from the internet there that replicated the parts of self she was seeing, and she was then able to create this whole system there that was very intelligently developed over the years, but was quite unconscious for my patient. But in it becoming more conscious, we are now at a stage in therapy where the parts are working more consciously together. There is more internal cooperation with one another, And when there are setbacks, when there are days there where the system is not working cooperatively, we're able to sit back and using this internal meeting room sort of metaphor, we're able to identify which parts are having conflict more clearly. So for me, that's been an incredible learning curve, and my supervisor was extremely encouraging, and she reassured me from the first point that I was already doing a lot of the interventions with the patient. It's just I was not looking at it from the DID lens. I was looking at it more from a post-traumatic lens. And she said the work is the same. The client now has this greater validation of her experiences and greater clarity of herself. And that is, in the long term, going to be healing for the client, and is overall going to help the personality start to integrate as per the structural dissociation model theory. Thank you.